Imagine this. You're 72 years old, finally taking that dream trip. And as the plane levels off, you feel a little lightheaded and think, what if something happens to me up here? That quiet fear sits in the back of a lot of seniors' minds. But what if I told you that the real story of in-flight medical emergencies is far less terrifying than the headlines make it seem? And knowing how it works can actually make you feel safer than you do on the ground? Let's start with some numbers, because numbers cut through fear fast. Studies of large airlines show that medical emergencies happen on about 1 in every 604 flights, so not on every flight, not even close. And of those emergencies, only a small fraction are truly serious enough to force the pilot to change course. Only around 4 to 7% of in-flight medical events end in a diversion, meaning well over 90% are managed safely all the way to the original destination. Deaths in the air are even rarer, on the order of a few cases per million passengers, so rare that many frequent flying doctors will tell you they've never seen one in decades of travel. And here's a comforting twist. A large share of in-flight medical issues are handled entirely by the cabin crew without even needing a doctor. But even when something more serious does happen, passengers are not alone. On many flights where a medical event occurs, there's a health professional on board, often a doctor, nurse, paramedic, or EMT, who can step up and help. So when you imagine yourself in trouble at 35,000 feet, the picture is not an empty metal tube with no help. It's a compact clinic with trained staff, specialist doctors on the ground, and often a volunteer medical professional right there beside you. Now, let's pull back the curtain on what actually goes wrong most of the time, because the phrase in-flight emergency can sound like heart attacks and last words. But the reality is much more mundane. Across tens of thousands of reported cases, the single most common problem isn't a heart attack. It's fainting or almost fainting, what doctors call syncope or near syncope. Roughly a third of in-flight events fall into this category. Why? The cabin is pressurized to about the equivalent of 5,000 to 8,000 feet above sea level. The air is dry, you may not have drunk enough water, and you've been sitting in a cramped seat, often after rushing through the airport. Combine a bit of dehydration, a lower oxygen level than you're used to, some anxiety, and maybe a glass of wine or a skipped meal. And your blood pressure dips just enough that you black out for a moment. Here's the reassuring part. That kind of fainting looks dramatic, but is usually not dangerous. The person is laid flat, their legs may be raised, they're given oxygen or fluids if needed, and they wake up embarrassed more than anything else. One emergency physician who frequently flies described being called to help a man in his 70s who slumped over mid-flight. He checked a pulse, asked a few quick questions, watched the man perk up with some water and oxygen, and the rest of the flight went on like normal. The biggest problem? The patient kept apologizing for making a fuss. The next group of issues are respiratory problems, things like asthma flares or feeling short of breath, plus good old gastrointestinal complaints, nausea, vomiting, or stomach cramps. Together, gut and breathing issues make up a big chunk of in-flight medical events. Again, these sound scary when you picture them on a plane, but on the ground they're everyday problems. The low cabin humidity and pressure can make your chest feel tighter if you already have lung disease, and turbulence or rich airport food can make your stomach revolt. Cardiac symptoms, chest pain, palpitations, make up a smaller percentage of in-flight emergencies, which means they are a minority, not the main story. Seizures, allergic reactions, diabetic episodes, psychiatric situations like panic attacks, and suspected strokes all appear too, but each of these categories typically represents just a small slice. True full-blown cardiac arrest, the dramatic scenario everyone fears, is very rare, a tiny fraction of in-flight medical events, not of all passengers. In other words, if you sat on a plane and watched every single medical incident for weeks, you might see one cardiac arrest, and that's on flights packed with millions of passengers. So, the terrifying truth is almost the opposite of what you might expect. Most in-flight emergencies are the same minor problems that walk-in clinics treat every day, just happening in a more dramatic setting. Now, you might be wondering, but if I'm the one who has a problem, what actually happens up there? Let's walk through it step by step, like you're sitting in 14C. You press the call button, or a nearby passenger flags a flight attendant. The first responder, always, is the cabin crew. They're not just there for snacks, they are trained extensively in first aid, CPR, the use of defibrillators, and managing common medical scenarios. They come to your seat, ask what's wrong, check how you look, and quickly decide whether this is something simple like motion sickness or something that needs more help. If it seems more serious, that's when you may hear the classic announcement, "Is there a doctor on board?" The crew isn't just shouting into the dark. They are trained to work with volunteer professionals and have protocols to confirm that someone really is a doctor, nurse, or paramedic. Once a health professional steps up, they effectively become the medical team leader, while the crew act as their hands and eyes, fetching equipment, relaying information to the cockpit, and helping with basic monitoring. At this point, the plane's medical kit comes into play. Thanks to regulations and years of data, commercial aircraft carry more than just Band-Aids. There is a basic first aid kit with dressings, antiseptics, and simple medications. There is also an enhanced emergency medical kit that includes tools like IV supplies, syringes, emergency medications, and equipment to check vital signs such as blood pressure cuffs and pulse oximeters to measure oxygen levels. On many flights, especially in regions like the US and Europe, an automated external defibrillator, or AED, is required on board, a device that can shock a heart back into rhythm during cardiac arrest. But here's the part most people don't know. The doctor on board isn't alone either. Many airlines contract with ground-based emergency services staffed by emergency physicians who are available 24/7. When a problem looks serious, the crew or captain contacts these doctors on the ground via radio or satellite phone. The ground doctor hears what's happening, asks questions about your symptoms, guides treatment, and helps decide whether the plane should divert to land early. So even if no volunteer doctor is on board, there's almost always an emergency physician effectively on call for your flight. Now, who decides if the flight will divert? This is another fear seniors often have. If I get sick, will I force the whole plane down? The reality is more measured than that. The onboard doctor or the ground-based physician can recommend diversion, but the captain makes the final call. They consider how sick you appear, how long it is to the destination versus the closest usable airport, what medical facilities are available on the ground, and safety factors like weather and fuel. Because diversions are extremely disruptive and expensive, they are not taken lightly, but they are absolutely done when necessary. When a diversion is chosen, air traffic control swings into action. They clear a path, give the plane priority to land, and coordinate with emergency services at the airport so that paramedics and sometimes even a full trauma team are waiting at the gate or on the tarmac. Remember though, this level of drama is rare. Only a small minority of in-flight medical problems ever reach the point where the pilot changes course. Let's bring this down to the personal level with a real-world story doctors tell often when they talk about in-flight emergencies. An emergency physician described being halfway over the Atlantic when a middle-aged woman started to feel crushing chest pain. The crew called for a doctor. He checked her vital signs, used the onboard oxygen and medications from the emergency kit, and talked through the case with a cardiologist on the ground. Together, they decided the risk of a heart attack was significant enough that the captain should divert to the nearest major airport. When the plane landed, paramedics were already at the door. She went straight to a hospital, where doctors confirmed a serious cardiac event. We'll get sick in the air sometimes, and the system is designed. from training to equipment to communication to handle exactly that. So if you're a senior who's been putting off visiting your grandchildren, skipping that cruise, or saying maybe next year to that destination you've always dreamed of, not because you can't afford it or don't have the time, but because you're afraid of what might happen on the flight, ask yourself this: is that fear based on facts or on imagination? The facts say medical emergencies happen, but not often. When they do, they are usually minor and handled without even turning the plane around. When something more serious happens, there is equipment, training, and a team, often on board and always on the ground, ready to help you. And you are not powerless. With simple steps like carrying your medical information, staying hydrated, moving your legs, and speaking up early, you dramatically tilt the odds even further in your favor. Here's the real, terrifying truth that almost no one says out loud. For most seniors, the bigger risk is not that something will happen to you on a plane. It's that fear of the plane will quietly shrink your world, keep you from moments with family, experiences, and memories that you can never get back. So the next time you're buckling your seatbelt and you feel that familiar flutter of anxiety, remember the unseen safety net around you: trained crew, medical kits, AEDs, doctors on the ground, and often a health professional in the seat across the aisle. Take a sip of water, flex your ankles, check that little medical card in your pocket, and remind yourself you're as prepared as modern aviation can make you. And if you want more content that takes scary-sounding topics like this, breaks them down with real data, real stories, and real-world tips designed especially for seniors and their families, make sure you subscribe, hit the bell so you don't miss the next episode, and share this video with someone you love who's afraid to fly. Because sometimes the right information is the safest thing you can bring on board.